that it was her kidneys that were the problem. Sometimes women can have gallstones during pregnancy. That they may or may not perform surgery while you're actually pregnant to address that. Sometimes they just make you wait. But any sort of unexplained pain like that definitely needs to be looked into. Any conditions requiring bed rest. So things like an incompetent cervix, which means that the cervix is like having a little trouble staying closed. Sometimes it's necessary, usually bed rest is enough intervention so that you don't have, if you're standing and walking, you don't have that pressure on your cervix. Sometimes the cervix needs to be sewn shut temporarily to keep it from opening too soon. Placenta Previa, that's when the placenta is placed like over your cervix, which means that when you go into labor, it can start disconnecting from the uterine wall, and then your baby is not getting the oxygen and nutrients that it needs, and that is an emergency. But usually they will know ahead of time if that is the case. And then related to that, placental abruption, that's also when the placenta is pulling away from the inside of the womb. And usually you'll have bleeding associated with that. But that is a true emergency. And then preterm labor, so if it's extremely early, like in the 6th, 7th, or 8th month, any threatened miscarriage, maybe they had a little bit of bleeding and cramping, but they haven't lost the pregnancy, but it was a little dicey there for a little while, massage contraindicated. Any growth problems with the fetus, high blood pressure, preeclampsia, and just keep in mind that any of these contraindications can arise at nearly any time. So you just want to make sure that you are having a good dialogue with your client, that you're not, missing something that's a red flag. The most concern for miscarriage is in the first trimester. Many women have miscarriages, sometimes several miscarriages, and you don't even know it because it just appears that you've had your normal monthly period. Some clients will choose to avoid massage during the first trimester out of an abundance of caution. Like I said, if there's any sign of a possible miscarriage, you're not going to do massage. And some clients have heard that there's an acupoint somewhere on the leg that could, immediately cause a miscarriage, and they're really freaked out by it. The acupoint that they usually know about is spleen 6, which is at the ankle. Is it gallbladder 21 and large intestine 4 also? But most people don't know about that as much as they know about spleen 6.
Kidney 3.
So out of an abundance of caution, I would just avoid any work around the ankle. You can do some light effleurage, but I wouldn't do anything deep there just to, put everybody's fears to rest, because it can cause a lot of stress if you think that your massage therapist is putting you at risk for a miscarriage. It can be very upsetting.
You want to see that on the model?
Yes.
I see there's a model right behind you. It's our one that doesn't balance well though. So the one that folks for some reason have heard about is on the medial aspect of the ankle, just behind the medial malleolus, which is kidney 3. So it's not going to cause a miscarriage to massage past this point, but we don't want to do a lot of focused circling or strong pressure in this area. Yeah. Any questions about that?
Also, remember back to reflexology that the reproductive organs are, their locations are both the inner ankle and the outside of the ankle. So we're just going to avoid that area just for everyone's peace of mind. Okay, so let's talk about what massage techniques and modalities are indicated and contraindicated during pregnancy. So the ones that are indicated are Swedish massage, lymphatic drainage. That comes in handy if somebody's having, swelling of the extremities. Trigger point release, reflexology is fine. And then postpartum, some like transverse friction can be helpful to release any scar tissue from a C-section, but of course you'd want to wait until the incision was completely healed before you did any scar tissue reformation work. The modalities that are either contraindicated or require extra caution would be myofascial release, assisted stretching, range of motion techniques, deep tissue, no abdominal massage in the first trimester. If you have your heart set on doing abdominal massage, you can do it in the second and third trimester, with their permission, of course. No rocking motions if the client is nauseated. Varicose veins are local contraindication, and then the use of heat. So heating pads, hot packs, table warmers, saunas, hot tubs, hot baths, all of that stuff. The commonality between most of these techniques is that they are focused on the fascia and the connective tissue. So the myofascial release, assisted stretching, range of motion techniques, and deep tissue will affect your connective tissue. And so any techniques that involve pulling on the limbs, releasing fascia, and deep stretching are contraindicated due to the effects of the hormone relaxin. So many people are familiar with that as a pregnancy progresses, the relaxin will kick in and your joints will get a little floppy. Sometimes your hip joints will get a little bit loose. Women will have like round ligament pain, and that's all from that connective tissue relaxing. That happens so that your pelvis can spread and to prepare you for childbirth. But it can also do things like make your feet wider because it's affecting all of the connective tissue in your body, not just the ones around your pelvis. So, if you are, performing assisted stretching, you may be stretching them beyond their actual tolerance without knowing it because their flexibility has increased and their joints are a little sloppy. If you have a client who has like conditions of the connective tissue like Ehlers-Danlos, you'll definitely want to get clearance from a doctor before working on them because that means that they already have very loose and stretchy connective tissue, and it's going to be made more so by the presence of relaxin throughout the pregnancy. I think for the most part, most of the people that I've met who have Ehlers-Danlos are usually aware of it because they've been extra flexible their entire life. You know, they can turn their arm around, they can bend their fingers backwards, you know, they can do the splits, you know, without warming up, that kind of thing. So just if somebody reveals to you that they have Ehlers-Danlos, that's going to be one of those red flags that you look for. Specifically with any of the modalities that affect the fascia and connective tissue. If you have somebody with Ehlers-Danlos, you can just avoid those modalities completely and do a nice Swedish massage. That is always, you know, erring on the side of caution. I know some people are copying this down. Do you guys need any more time?
No, I mean, that's, you're going around the module, right?
Yes. So local contraindications, no deep work on the abdomen. I think that's pretty self-explanatory. If you're going to do work on the abdomen, light effleurage only. No massage should be performed on the medial legs during pregnancy for up to 6 weeks postpartum due to the risk of clots and deep vein thrombosis. You can do some non-circulatory techniques in those areas, but some therapists just avoid the medial leg completely. All right, so positional considerations. So when your client is supine, their uterus is going to rest. It's going to lie against the spine, and it's going to put pressure on their aorta and the inferior vena cava, which reduces the blood flow to the fetus and to their lower extremities. Most of the time, they will be able to tell you that they are getting, you know, if that is the case, that they are getting like tingling in their, you know, legs and feet. But the reason why we use a semi-reclined position is so they're not flat on their back with all of that weight directly on their aorta and inferior vena cava. To prevent this, especially later in pregnancy, you can use a rolled up towel, a small wedge, or a pillow to place under the client's right hip so that you can tilt them slightly to the left. That way the pressure isn't directly on those vessels. The maximum amount of time that can be really safely spent in a supine position in second and third trimester would be 10 to 15 minutes. I wouldn't do any longer than that. Reclined supine position with support under the legs will allow you to spend a little bit more time supine, but it's always safer to just transition to side lying. And then with side lying, I try to keep my clients on their left side. So just like we tilt them slightly to the left side, I like to keep them on their left side longer, and then I will keep them on their right side for that same reason of that pressure on their aorta and inferior vena cava. And that is, just to clarify, with side lying. So I will usually start my client on their left side and keep them there for the majority of the massage and then flip them to their right side. All right, does anybody have any questions so far?
Lots of info.
Yeah, a lot of info. To be able to do this safely requires a lot
See
of
why some
education.
people just avoid it.
Well, like, I mean, all of these things are like things that could just go wrong anyway. Like, it's not like we're just interacting with it because we're having to like be there with them for an hour and a half.
Right.
And something could go wrong, but yeah.
All right, so just in case you are not familiar with the trimesters and the weeks of pregnancy, so a pregnancy is 40 weeks long, right? And the first trimester, so there's some discrepancy between textbooks about exactly what week the first trimester ends. Some say 13 weeks, some say 14 weeks. I went by pregnancy, childbirth, and the newborn. So it's the first trimester is the first day of their last period up to 14 weeks. I think that for your assignment for reading the book, one of the questions is about the trimesters, and it says to 13 weeks. So when I'm grading that, 13 or 14 would both be correct. It just really depends on the source. The ones that are consistent are the second trimester, which is 14 or 15 weeks, depending on when the first trimester ends. So I usually consider that 15 to 27 weeks. And then the third trimester is 28 to 40 weeks. All right. So we talked a little bit about the, the common discomforts, aches and pains that moms have during pregnancy. So your nausea, dizziness, fatigue, sciatica and edema, and back pain. So back pain is super common. It usually occurs during the fifth to 9 month when you are starting to get, when your belly is getting heavy and your posture is starting to change. It's very often felt in your SI joints, in your hips, and also your pubic symphysis. And this is, again, because of that relaxin, because of that posture change. It's going to change your center of gravity. And so you're going to have like a forward rotation of your pelvis, which is going to put more stress on your lumbar spine and your SI joints. And then you also have the broad ligament, which is the ligament that attaches the uterus to the sides of the pelvis, and then the round ligament that attaches the uterus to the lower area of the pelvis. That can get very uncomfortable. So if you have a client with a round ligament pain, they may wear like a belly band to lift their belly a little bit and take the pressure off that round ligament, because just the gravity is just super painful. There's not a whole lot as massage therapists that we can do for that ligament pain other than treating their back pain and their postural issues. So swelling, edema in the feet and ankles, sometimes also in the hands and arms. Wrist edema can give pregnant women like a temporary carpal tunnel that we can treat. Heartburn, indigestion, and Gerd are super common, so that may be something that you have to adjust position for. If someone has really intense heartburn, they may not be able to lay side lying, or they may only be able to lay side lying on their left side. If you have heartburn, laying on the right side can make it worse. So that's something to check in with if you have somebody with really bad heartburn and indigestion issues. Sometimes the semi-reclined is going to be the best bet for that. Swollen and painful feet, super common, especially as you get toward the end of the pregnancy. It's from the extra baby weight, from the change in posture, from the relaxin causing your feet to spread. So foot massage is, I wouldn't say it's a requirement, but it's a very special treat.
Yeah, we haven't, I think we started with the pathology for like local contraindications, but
Do you guys remember if we were going over inflammation? Like, have we talked about that yet?
Just general inflammation?
Yeah, I mean, like if your foot is like super swollen because of like diabetes or because of this, yeah, I don't know. I guess we haven't really gone over like.
Yeah, we're going to get into that in injury evaluation and
Okay,
treatment
cool.
and talk about like the stages of inflammation and what to look out for.
Okay, cool.
Unless they've had, you know, an injury, or there's some sort of pathology involving inflammation like that, but like the normal, like feet swelling, you know, that's like retaining water. That's not like, you know, the heat of like an infection.
Okay.
Or an injury like a sprained ankle.
Okay, I guess I was thinking it was the same thing, but cool. Thanks for that.
Is there anything you'd add to that, Zephyr?
Well, you know, of course they could have gestational diabetes, and so they're receiving regular medical care. They should know about that. You know, that's different than the just typical swelling ankles and feet. And one sign that's kind of a red flag, aside from just the normal swelling, is what's called pitted edema. So if you press it and it stays indented, that's a bad sign.
And also if they have like super uneven swelling, that can indicate that, you know, they've got a clot in their leg. But some people will just have their regular edema and it'll be a little bit worse on the left side. That's pretty common. So I would use your best judgment with that, but definitely the pitting edema is a sign to look out for. Headaches. So I would say most of the pregnant clients that I've worked with have complained of headaches, and those can be caused by hormones. They can be caused by just stress, neck and shoulder tension, the postural changes that come with pregnancy. It can occur due to sinus congestion or dehydration, and sometimes caffeine withdrawal if they have quit coffee. The pregnancy headaches often diminish during the second trimester, but some people have them their entire pregnancy, or they'll have like hormonal headaches at the beginning of pregnancy and then stress headaches toward the end of pregnancy. And that's not counting clients who also have something like a car accident in addition to the regular headaches that they're experiencing. So we've talked about nausea several times, most common in the first trimester. You can get shortness of breath, congestion, allergies, and the respiratory accessory muscles, so your scalenes, your SCM, your pec minor, often hold a lot of tension because you're having to breathe higher up in your chest and you're not able to take as deep a breath. So those muscles are kicking in so that you are, you know, able to breathe higher up in your chest. Some women have stress incontinence, so that means that they pee a little bit, just due to the pressure on their bladder. Sometimes that goes away after pregnancy. Sometimes that's just something you have to live with. So like we talked about with body fluids, if your client pees a little bit on your table, just use your universal precautions and make sure that you clean it up properly. For postpartum massage, you're going to look for things like the local contraindication of epidural site. So if they had an epidural, I haven't had too many clients who come in for massage immediately after they had a baby, but it's a possibility. So if they still have a wound there, you're going to go ahead and avoid it. If they are recovering from a C-section, or if they're having, the swelling of their breasts or pain from nursing, you're going to want to avoid being prone. And then the postpartum period is just super stressful for for both your new mom and their birth partner. I had a new dad who came to see me regularly, and he was a mess, surprisingly, quite a mess, just from the new stress, lack of sleep, the tension in their neck, shoulders, and back and arms from holding a newborn, bottle feeding, breast milk spilled on your linens is a body fluid, and so you're going to want to use gloves and universal precautions when dealing with any breast milk. It's a body fluid just like any other. Massage can help the rectus abdominis heal. So during your pregnancy, the rectus abdominis splits, and some women, it doesn't come back together like it should. There's actually like specific physical therapy to try to get that muscle to knit back together like it should. But it can cause a lot of weakness in their core, and massage can be really helpful to draw those muscles back together toward the midline. Some vibration can be really helpful. And just letting, if it's very troubling, especially that loss of core strength can be very troubling, and it can go on for years and years. A lot of people don't know that there are techniques and interventions that can be done specifically to address that, to rehabilitate the abdomen after pregnancy. And then also scar tissue from C-section. Okay, I think we're at the end here. Infant massage. Actually, I want to talk about